The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you. And if you're just tuning in, we're a show about how our older adult population can live a healthier, happier life. We come at you every single Friday, and today's no different. We're coming at you live from the Scottsdale Air Park Studios. It is December 11th, and I am real happy to have one first-time guest here to the show. I have Dr. Erkut Borazanci. Welcome to the show.
Welcome, Bob. Thanks for having me.
We're happy to have you here on the show, and I want to do a real quick introduction. You're a medical oncologist, a clinical investigator at HonorHealth Research Institute.
That's correct.
And we're here today to talk about pancreatic cancer. Last month was National Pancreatic Cancer Awareness Month. We've all seen the headlines of our beloved television game show host, Alex Trebek, who lost his life to pancreatic cancer last month. Mm-hmm. And stage 4 pancreatic cancer has a 5-year survival rate of 1%. The average patient diagnosed with late pancreatic cancer will live for about 1 year after diagnosis. But HonorHealth Research Institute is looking to change that in its pancreatic cancer treatments and clinical trials. So today we have the pleasure of talking to you. And if you're okay with it, I'd like to call you Erkut.
Sure.
All right. And would love to hear about some of the work that you're doing in terms of research. First of all, I want to pay homage to the leader, Dr. Daniel Von Hoff, who is a rock star and has gotten worldwide notoriety, not just for the work that he's done here, but the work he's done throughout the world.
Absolutely. We call him Dan, and what Dr. Von Hoff has built over the last 15 years out here in the Valley has been tremendous, and really looking at what the science has shown us with various cancers, and particularly with pancreatic cancer, and what we can do to give better options, and that's led to more hope and better survival for people with pancreas cancer.
And I know that so many people, when they get that diagnosis, and if they follow anything about cancer, it's one of those gut wrenchers. I mean, you get the lump in your throat. Oh no. And I know that we're doing a lot of great research here, but correct me if I'm wrong. I mean, symptoms. Do we have the ability to recognize symptoms? Because some cancers you are.
Right. So you're absolutely right, Bob. Pancreatic cancer, there's several challenges with it, and just to also clarify, there's two types of pancreatic cancer. The one that we will focus on and we talk about the most is pancreas adenocarcinoma. There's a different type of pancreatic cancer that comes from the hormone cells. We call this pancreas neuroendocrine cancer. So it's also important to understand what type of cancer you have. But pancreas cancer, pancreas adenocarcinoma, is the more common one, and that's the one that you speak of, that the survival is unfortunately quite poor. The problem with pancreatic cancer in general is the fact is that we don't really have that screening test for it. When you talk about other cancers like breast cancer and colorectal cancer or even melanoma, you can get a mammogram, you can get a colonoscopy, you can go see your dermatologist and get a good skin exam, and you can notice things on the surface or feel things. For pancreatic cancer, you may undergo vague symptoms. Some of them may mimic other diseases that are completely harmless to you. Sometimes people have abdominal pain, and the abdominal pain can be in their center of their abdomen. Sometimes it can go to their back. Sometimes it's associated with different types of food, and also that can lead to issues with digestion, diarrhea, and loose stools. But these can mimic other types of conditions that are completely harmless. And a lot of times, by the time a person is diagnosed and they come to see me, they're usually diagnosed at an advanced stage, meaning that the cancer has spread beyond the pancreas into other organs.
Right.
And usually what happens too is that they may undergo a lot of other tests. They may undergo an upper endoscopy. They may undergo a colonoscopy. But you have to have specialized tests to really find it. And sometimes even getting a CAT scan MRI will be able to find it. But even with that said, it remains a challenge to catch it early.
You know, and really talking about catching it early, you know, I guess it's logical for me to say, so what are some of the risk factors? What are some of the risk factors that people should know?
So there are a few known risk factors. One that social risk factors, we call it things like tobacco use. So we think about smoking being a risk factor for lung cancer.
Right.
But it's also a risk factor for pancreatic cancer. Also alcohol use. When we're talking about alcohol use, we're talking about 30 units or more per week. And a unit is a 2-ounce liquor, 12-ounce beer, that type of thing. So heavy alcohol use over a period of time. We know that obesity also is related to pancreatic cancer, and I am starting to see individuals that are diagnosed at a younger age. Typically, we think of pancreatic cancer being involved with someone in their 60s or older, but we do find people coming in the office being diagnosed in their 40s and also their 30s. It does affect men and women equally, and it doesn't really care what race you are. All
Right.
races are affected equally with this cancer. We also know that pancreatic cancer does run in families. There are identified syndromes, genetic syndromes, that are associated with a risk for pancreatic cancer. So we think about things such as breast cancer having a BRCA gene. You may have heard about that.
Of course.
Your listeners have heard
Yeah,
about that.
we've talked about that.
Absolutely. But those same genes also are associated with a risk for pancreatic cancer. And every year we've been learning more and more about these types of genes that may be associated with pancreatic cancer risk. And so it's important for everyone to be aware of their family history and to talk about that with their doctor, and to talk about and ask the question, do I need to undergo genetic testing? Should I look for that gene? Maybe my mom had ovarian cancer. Maybe that means that I carry a BRCA gene or something like that. And to talk to that specialist to understand, okay, what does that mean for my risk for other cancers? And then the important thing, too, is to be aware of your own personal family history, too. So we do find that even outside of things like BRCA, we find that there are families out there that mom had pancreas cancer, grandma on mom's side, or an uncle on their mom's side. So when you have 2 or more family members on the same side of the family that have pancreatic cancer, that could indicate that you have a familial pancreas cancer. And so it's important to, again, talk to your doctor, and also to be aware that there are programs around the country, including here at HonorHealth, where we are looking for people who are at high risk for pancreatic cancer, and we're looking at ways to detect the cancer early, in addition to develop better tests to catch the cancer early.
So it's interesting. So once you know that you might be genetically disposed to this, I mean, there are screenings that we could go through if we have that information, right?
Absolutely. It's still a emerging field. There's a lot of data that's being developed. There's a lot of tests that are being done. The most common test that we recommend for people that have a strong family history, a strong risk for pancreatic cancer, is an MRI. There's no radiation involved with this type of imaging of the abdomen. But it's also important to look for and seek out for places and centers that are really focused in on that, to see if there are established protocols and guidance to make sure that they're being tracked and followed closely. But there are things that we can do right now that we're also hopeful to do in the future. And to that end, we're at HonorHealth, we're also involved with the National Institute of Health's project to look for a better biomarker to catch pancreas cancer early.
Well, you know, I quickly kicked off by introducing you, but I didn't really talk about, I know I said that you were part of the HonorHealth Research Institute, but HonorHealth is doing some amazing things as it relates to cancer and certainly pancreatic cancer.
Absolutely.
Erkut, I told you it goes fast, so we're down one segment.
Okay.
Got a little bit of Coldplay taking us out in the first segment. Stick around. We're talking about pancreatic cancer, and we're talking about some incredible research that is being done right here in our backyard in Arizona, Scottsdale, Arizona, and particularly HonorHealth. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and we're in our second segment. If you're just tuning in, I've got from HonorHealth Research Institute, I got Dr. Erkut Borazanci, and he is a medical oncologist on the clinical team there, and they are working on pancreatic cancer. If you're not aware of it, HonorHealth has been working in this area for a long time. Their leader is Dr. Daniel Von Hoff, and he is worldwide recognized. And in our first segment, we talked a lot about, what pancreatic cancer is, what are some of the risk factors. We talked about Alex Trebek, who is like a national star. Everyone knows about him, and he was very upfront and personal with us. And I think it's really important for people that have platforms like that to really talk about these types of illnesses and the treatments. I mean, that guy, he went all the way up to the end, and I mean, you would have never known that he was battling this battle that he was dealing with.
Well, it goes to show how important advocacy is. If you look at other cancers, look at how tremendously impactful the Susan B. Komen Foundation has been for breast cancer, and you see other foundations like that. That advocacy is so important, and also just being able to talk about it and to talk to your doctor about it, and talk about it with your loved ones and family members.
Yeah, it's kind of like I also think about beside Alex Trebek, I think Randy Pausch, that last lecture. I don't know how much you know about him, but I mean, he was very outspoken about the cancer he was dealing with, and I think it's important for people to know what those battles are, and it shouldn't take you completely down, and it's not woe is me. They just keep going. That's
right. And again, it brings up a great point about if one were to be diagnosed with pancreatic cancer, it's important to not only ask questions and to also look for those avenues for individuals that are experienced with dealing with pancreatic cancer, and what advocacy groups out there and what resources they can tap into to learn more about their cancer itself, so they know what to do.
Yeah, I don't know how much you know about him, but I was following him back in the early 2000s, and I mean, he gave his last lecture, and he went up and he did like 40 push-ups, and he's like, this isn't going to hold me back, and really talked about the importance of life and the lessons that he had learned and tried to share them with others. So I mean, look, you should be commended. I mean, the work that you guys are doing, you're helping not only the individuals but their families get through some of the biggest challenges. And I personally, I have a rabbi who I'm very near and close to with, and I think I shared with you before we started the show. His mother had pancreatic cancer, and she lived for nearly 3.5 years, and her prognosis was not good. And the fact that she got that much time, and many of those years were pretty good in terms of quality.
Yeah,
it's a real statement to some of the research that's being done.
Yeah, absolutely. You quoted statistics in the beginning of the show, and even though currently the overall 5-year survival for pancreas cancer is 10%, there's been tremendous strides in the last few years, and we've been able to see that next anniversary, that next birthday for several of individuals with pancreatic cancer, even being diagnosed at an advanced stage.
So I think that one of the things that I marvel at, and I know this just because I'm a student and I read a lot, and I haven't read I haven't read recently a lot of this work that Dr. Von Hoff and what they're doing over at HonorHealth. But I think the greatest thing is that it's collaborative. You guys aren't
Yeah.
working in silos.
That's right.
I
Yeah.
mean, and if you could talk a little bit about that, because
Sure.
I mean, you probably know so many of the physicians out there and
Yeah.
researchers that are working on this.
Well, again, it goes back to looking at the cancer and understanding how the cancer comes about and what can we do to implement the advancements. And we're fortunate here in the Valley to work closely with TGen, the Translation Genomic Research Institute
Right.
in Phoenix. And so we have a partner close by that helps us as far as looking for where there's opportunities to help people out with pancreas cancer better. But also, we've been fortunate to work with other colleagues around the country, around the world, and being participants in collaborative grants, not only through the National Institute of Health, but also through Stand Up to Cancer. We've also been fortunate to receive support from the Sina Magwitz Foundation, which is also the intention to bring all these different physicians and doctors and researchers all together with the same purpose. And without the advocacy and without that awareness, it can't get done. And it has to require several different people from around the world to really work together to make things better.
You know, it's interesting. You know, we're all watching what's going on with this pandemic, right?
Mm-hmm.
It's consuming us. And people are like, you know, wow, we got a vaccination for this virus.
Mm-hmm.
And we're hoping it works.
Mm-hmm.
And, you know, I've read, you know, blogs and I've read in periodicals saying, well, if we were able to do that for coronavirus, why haven't we been able to cure cancer for all these years, right?
Well, a virus is one thing. A cancer is a completely different story. And again, it does. You know, some cancers we've made tremendous strides for. Again, as I talked about before, with early detection, that's made a huge difference. If you look at even breast cancer, our strides that we make for people with breast cancer are catching it early, being advocates, awareness, and catching it at an early stage, and then implementing therapies that give them the chance to live as long as possible. We're not quite there yet with pancreas cancer because it's a difficult cancer to catch early. So as we're developing better tools and again, really awareness too, now we're finding some individuals that are being diagnosed with stage 1 pancreatic cancer. And these are sometimes incidentally found. They may have what they think is a kidney stone, and so their doctor gets a CAT scan or MRI, and they find that, oh goodness, there's something in your pancreas. Let's take a look at it. So that's why it's important that awareness exists. So if someone says, "Geez, you know what's going on with my abdomen," they pursue that avenue, and they're aware of that too. And it's important to understand, again, what are my options? What should I do about this cancer?
Well, it's interesting because, one of the things you did talk about in our first segment is genetic disposition.
Mm-hmm.
And you talked about, some of the symptoms that, that one might feel and some of the, things that may lead to pancreatic cancer. But at the end of the day, I mean, what I hear you saying is that you got to pay attention to your body.
That's right.
Your body's an incredible machine, and it's talking to you. Mm-hmm. And if you are feeling something that just isn't right, you need to get in and see your at least your PCP.
That's correct. I think that having that communication and really understanding what's going on is important. And again, it's and once the cancer is found, again, asking the right questions and figure out what to do beyond that too.
And the other thing I found interesting in the first segment, and I'm a little slow today. I was up late last night because our hot water heater went. And if anyone has ever experienced one of those things, till 2 o'clock in the morning, so my neurons are just finally clicking, and I'm thinking about some of the things you talked about in terms of what are some of the risk factors. I mean, the risk factors are the same for a lot of different cancers and a lot of other illnesses and issues that are out there. But the fact is that one of the first things you talked about was smoking. Mm-hmm. And then the second thing you talked about was alcohol. Mm-hmm. And, I think about, hey, you know what? We've made so much progress, but have we really? Because, now we got people that are vaping. We got people, with this pandemic, they're feeling depressed and they're opening up alcohol and they're drinking more than they probably were before. I've had a few more glasses of wine than I had before the pandemic, but I'm not abusing it. But I'm just saying that those are risk factors, and
Mhm.
those are risk factors that contribute to it. One of the things you didn't talk about, but I'm sure it does contribute to it, is diabetes, right? I mean, the fact is your pancreas.
So your pancreas is an important organ that we don't really think about that much. As I mentioned before, it sits pretty deep in our abdomen, and it really the way we view it, it accomplishes two major things. One, it helps with our digestion. The second thing is that it does help metabolize sugar, and so a lot of times we find that diabetes is associated around the pancreas cancer diagnosis. Sometimes diabetes predates the pancreas cancer diagnosis by several years. Recent research has indicated that individuals that are 50 years or older, if they develop diabetes, particularly in the context of weight loss of just 10 pounds, are at a significantly increased risk of pancreatic cancer.
Interesting. Really, really interesting. I've got so many more questions, and one of them that I definitely want to ask, and I want to wait till the second segment for our second half for you to answer it, is we've made so much progress with organ transplants.
Mm-hmm.
We do kidney transplants, we do liver transplants, pancreas transplants. I want you to take some time
Sure.
because I want to talk about that. I mean,
Okay.
why can't we transplant a pancreas and have someone just start fresh? That to me that makes sense, but I'm sure it's not that easy. You've been listening to Health Futures Taking Stock in You. I've got Dr. Erkut Borazanci from HonorHealth Research Institute. Stick around. We're down one half. We got the second half coming right up. It's halftime here at Health Futures.
Being in control of your money provides freedom. Learn how to make it, spend it, and invest it. We're Money Radio 1510 and 105.3 FM.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. My name is Bob Roth. I'm your host, and I've got Dr. Erkut Borazanci here in the studio with me. He is the medical oncologist and clinical investigator at HonorHealth Research Institute. We were talking about pancreatic cancer, and I left off in the second segment asking him about pancreas transplants. But before we do that, I want to learn a little bit more about you, Erkut. I want to learn a little bit about where you're from. You told me a little bit about LSU and winning the national championship, and I want you to tell us a little bit about yourself and really how you got into this area.
Sure.
And how did you come here to Scottsdale?
Sure. I think of myself as a native of Baton Rouge, Louisiana, Louisiana resident, growing up in New Orleans and Baton Rouge, and doing my college at LSU and doing my residency and fellowship over there. And what I did before medical school, though, was I did a master's program in molecular biology, and so looking at cancer from a research lab perspective. And it was pretty incredible to hear about some of the insights being made week in, week out in cancer. And what happened during fellowship was that I came across a young individual who was diagnosed with pancreatic cancer. She was actually in her late 30s, and she had a few young kids. And I saw her at diagnosis, and then I saw her 2 months later succumb to the disease. And it was obviously very, very shocking to see. And this was during my residency training. And so when I moved on to fellowship in oncology, I was very interested in pancreatic cancer. And my professors at LSU had brought up some of the work that's being done around the country, around the world, and one of them had known of Dr. Von Hoff, Dan Von Hoff, out here, and I had met him at a conference that was strictly on pancreatic cancer through what's called the American Association of Cancer Research, and it was a small meeting in Lake Tahoe, and he gave the plenary talk. And once I heard him give that talk, I said, I've got to work with this guy. I got to meet this guy, and I got to work with this guy. So I came here 7 years ago, and the interest has been in looking at those scientific papers that we were studying when I was in getting my master's degree, and then bringing those same drugs and targeting those same pathways in cancer, and being able to take that great science and bring it to people was very appealing to me. And we've been able to make some tremendous strides over the years that I've seen with my own eyes with people with advanced disease. As you mentioned before, some people come in, they get told various things. A lot of it is, well, let's get your affairs in order, and you only have X amount of time to live. It's usually a few weeks or a few months, and we say, well, let's look at what we can do for you. And some of the strides we've made have been built upon the advancements in the last several years to better take care of these patients.
Well, it's interesting. You talk about your first experience, and I'm sure you often think about that woman,
Mm-hmm.
the young woman with her children, and think about the progress that we've made. And
Yeah.
and I have been involved in Alzheimer's, in terms of the way we care for dementia and Alzheimer's. I served on the board for the Banner Alzheimer's Institute, and Dr. Eric Ryman,
Mm-hmm.
used to say when you got a diagnosis of that, it was diagnose and adios, right?
Mm-hmm.
And it used to probably be the same way with pancreatic cancer, and now there's some hope. There's light at that end of the tunnel.
There is. The as I mentioned before, we've been participants of different cooperative groups and different cooperative grants, and so if you look at the last 3 approvals for pancreatic cancer, 2 of them came from our center here in Scottsdale, Arizona, as far as the very first person. But even building upon that, one combination of gemcitabine and nab-paclitaxel that did show an improvement in overall survival for pancreas cancer. By looking at individual tumors with pancreatic cancer, we noticed there was a common thread with DNA repair. And we added a 3rd drug called cisplatin. And so those 3 drugs together showed a response rate, meaning a significant tumor shrinkage rate of over 70%.
Whoa!
For pancreatic cancer, the standard therapies are somewhere between 20 to 30 to 40%. So this was seeing something that was incredibly encouraging that we were able to report and publish on in JAMA Oncology late last year. So certainly we are looking at even further improvements in advanced disease and trying to build upon that base of therapy. We're looking at other things that we can utilize, whether it's looking at therapeutics with high-dose vitamin D, high-dose ascorbic acid. Some of it is the immune system, immune therapy to allow the body to attack the cancer itself. So there's been a lot of encouraging things that we've seen for people. And we've also been able to bring that, more importantly, to the greater world.
Right.
We have conferences, and we publish upon those. That very regimen that I talked about with that 70% response rate, that was actually of interest to our colleagues at MD Anderson and the Mayo Clinic. And so they took that very regimen, and they also did a trial with a different type of cancer that's a cousin of pancreas called biliary or cholangiocarcinoma. And they are now taking that to a greater number of individuals too in that other cancer. And so from a 10-person trial, which is what it was initially, to now a national study in a different type of cancer, along with studies that we're doing with pancreatic cancer with our partners around the country, around the world. It's a tremendous thing to see that impact that's being made just coming from here.
And it goes back to what I was saying in our second segment in terms of how collaborative the effort
Mm-hmm.
is, and how no one's siloed. Everyone's sharing information.
That's right.
And we have to. If we're going to find a way to
Yeah.
beat this thing, we've got to do it together.
We do, and we have to talk to each other, which we do. The pancreatic cancer research world is actually a lot smaller than you think it is, and someone will come in and they'll say, "Do you know so and so from so and so institution?" and we tend to know each other very well. We get together in international conferences. We actually get together in teleconferences. Today I was on the phone with folks from centers from New York, from Germany, from Florida, all working together for the same cause.
I love it.
So.
I love it. So I got to go back to the question.
Sure.
So transplant.
So, it's a great question. I do get asked that quite a bit.
Yeah.
Transplant in general, the way that transplant works right now, so let's take an organ such as your liver. For a liver transplant, to number one, you have to find a match, but even then, you have to take medications to allow your body to not reject the organ.
Exactly.
And so you actually are taking medications to cause immunosuppression. And besides the concern over organ rejection, the second concerns that people have with transplant is cancer. And so pancreatic cancer is notorious for basically evading your immune system. So if I were to suppress your immune system, that actually wouldn't be good for you for pancreas cancer. And despite, even with pancreatic cancer, even though someone may come in and they say, geez, Dr. Borazanci, I'm diagnosed with a very localized pancreatic cancer. That's great. We still get worried about that one bad cell beyond the pancreas. And so that's why the aforementioned combination treatments that we are doing for advanced disease, we're actually bringing to people with localized pancreatic cancer, because that gives them a much better chance to utilize chemotherapy, probably radiation therapy, and surgery to even beat localized pancreas cancer. And that's been also one of the major challenges with pancreatic cancer.
Well, we're almost down 3 segments here. So I want to follow up in our 4th segment. I want to talk about what are some of the questions people should be asking if they get a positive diagnosis. And then I want to really conclude in terms of you talking a little bit more about some of the clinical trials you're doing that are being done right here in HonorHealth Research Institute. Dr. Borazanci, it's so great to have you. Stick around. 3rd segment done. Last one's coming right up. Stick around. Bye-bye.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. If you're just tuning in, we're in our 4th segment, our final segment here today, and I am pleased to have Dr. Erkut Borazanci here in the studio. He is a medical oncologist and clinical investigator at HonorHealth Research Institute. And if you are interested in finding more information, call HonorHealth Oncology Nurse Navigation Team at 480-323-1364, or you can email them at clinicaltrials@honorhealth.com. And I love having you here on the show. I mean, you are giving us some hope for that diagnosis. I said before, comment that Dr. Eric Ryman said at Banner, they used to say in the old days, diagnose and adios.
Mm-hmm.
I mean, there's still hope, and you guys are doing so much. And I wanted to ask you, what are some of the questions people should be asking if they do get a positive diagnosis of pancreatic cancer?
Well, some of the things that's important to know is my cancer localized? Has it spread beyond the pancreas? Have you looked at places that it typically goes to? We know that the pancreas can go to the liver, can also go to the abdomen, also can go to the lung. And so making sure that you're asking your doctor, is it localized? Is it advanced? There's also other things that your doctor can also order for you that's very helpful, including a cancer marker called a CA19-9. There's other cancer markers out there, and there's also cancer markers in development too. And the other thing to ask in the greater sense too is to understand what resources are there available, and what should I be thinking about as far as my therapy. As I mentioned before, we think of pancreas cancer even in the early stage of diagnosis, meaning that it's confined to the pancreas, that there's still a concern that there's these bad cells that are circulating around our body. And so these systemic therapies, these chemotherapies that we've seen some success in the advanced disease, we now bring to the localized pancreas cancer with the hope that we can work together to attack the cancer. And finally, the other thing that I would also recommend for people to talk about with their doctors and their family members is the doctor that is my doctor working with other doctors. Pancreas cancer, it takes a village. You have to have the surgeon, you have to have the radiation oncologist, the oncologist, even with localized pancreas cancer. But even with advanced pancreas cancer, there's a lot of challenges that we may need to use our gastroenterologist to do advanced endoscopy procedures. And so there's a lot of complexities to pancreatic cancer.
You really do need your village. You need your entire team, because as you shared, it affects a lot of the organs.
That's right, and there's a lot of challenges involved.
No doubt. Treatment options.
Mm-hmm.
What are some of those? I know you mentioned radiology, but what other treatment options are there?
So again, if when we think about pancreatic cancer, we're inevitably talking about some level of chemotherapy. And so chemotherapy, different types of drugs that attack the growth of these cancer cells, and these are utilized in combination nowadays. And depending upon where the diagnosis is, if it's a localized pancreatic cancer, then it could be chemotherapy with surgery, and a lot of times you also have radiation oncologists being involved with offering radiation therapy to the cancer itself too. So there's various combinations out there. There's places like at HonorHealth Research Institute where we're looking at various combinations and adding on to them and looking for newer therapy to attack the cancer itself.
And surgery too, right? I mean,
surgery
is an option.
Surgery can be a great option, and the hope always is that with localized pancreatic cancer that you eventually do get to surgery. The hard thing about pancreatic cancer, though, historically has been in the past, most people would go to surgery first with localized pancreatic cancer, and then unfortunately would still find out that they had cancer in their liver or their lungs or someplace else in their body. The reality is this phrase called micrometastatic disease does exist, meaning that our scans, as good as they are, can't catch the cancer beyond the pancreas a lot of times. And so we do advise people on utilizing a multidisciplinary team where you have surgeons working with the oncologist and the radiation oncologist to give a global approach against even localized pancreatic cancer.
So as we wind down, we only have a couple minutes left. Can you give us at least some detail on the clinical trials that you're doing over there at the HonorHealth Research Institute?
So as I mentioned, one of the exciting things was the publication of a combination of gemcitabine, nab-paclitaxel, and cisplatin that was led by my colleague at HonorHealth, Gail Jamieson, a nurse practitioner and clinical investigator there. I've looked at a combination with that chemotherapy with vitamin D along with an immunotherapy called nivolumab, and that showed a 83% shrinkage rate in advanced pancreatic cancer. As I mentioned before, we've taken that chemotherapy combination of gemcitabine, nab-paclitaxel, and cisplatin with localized pancreatic cancer, and we've utilized the opportunity to look at that cancer marker, that CA19-9, that could be elevated,
right,
and looking at of how to get this down to normal. Because if you can normalize it, it leads to better survival outcomes. And so we've been able to show that our combination can normalize it by 50% of the cases. And if you look at the other therapies that are out there, it's been reported between 20 to 25%. So we're taking those insights and bringing them earlier onto the disease. And the biggest thing that we're also looking at is early detection, looking for those family members that could be at risk, family history, or those genes that I've talked about before. And again, that's where talking to your doctor, your primary care, and talking to a genetic counselor could mean a lot as far as understanding those risks yourself.
And, it's interesting, always it comes back to genetics, right?
Mm-hmm.
And you need to understand your family history.
That's right.
And if you have a history of pancreatic cancer, you should be being checked.
Yeah, absolutely.
So, what questions have I asked? I've asked you a ton, and we're getting ready to wrap it up. Or what lasting comments would you like to leave our listeners?
I want to leave everybody that there is a lot of hope, The cancer gives us reminders of how difficult it can be, but there are people that are out there, and it's important to look for individuals and advocacy groups out there that are a voice to pancreatic cancer. And so we've made tremendous progress thanks to our colleagues around the country and also around Phoenix at TGen, but there's a lot of hope for pancreatic cancer.
No, it's nice to know. It really, really is. And again, the best way to get a hold of the HonorHealth Research Institute is to call the navigation team, right? And that's
right.
480-323-1364. How's LSU doing this year?
2021. We're already looking forward to 2021.
You miss Joe Burrow, don't you?
We miss Joe Burrow a lot.
Yeah.
We do. Yeah.
He was a phenomenal quarterback, and I will share with you, I'm originally from Baltimore, and we had a great quarterback that came out of LSU by the name of Burt Jones, the Ruxton Rifle.
Yeah.
And I became somewhat of an LSU fan for a while because of him. So you got a lot of hope. How about basketball?
Basketball may actually be very good this year. Yeah. So I don't think they're ranked, but I think they're going to be pretty good this year.
No, fantastic.
Yeah.
Well, listen, Dr. Erkut Borazanci, it's so great to have you here on the show. And, you guys over at HonorHealth Research Institute are doing some marvelous stuff here. And it's really a great honor for me to give you this platform to talk about the work. And, I want to hope that we have a future where it's not diagnosed and adios, right? Where you get a diagnosis and there is hope. And I think the leadership that you have with Dr. Dan Von Hoff is a really big deal. And we're happy to have you here in Scottsdale. You did tell me in between the breaks you're a hiker, so you're supposed to have great weather this weekend.
Yeah.
So hiking might be on the menu. So to
and
speak.
by all means, mask up, everybody.
Yes, please do. And we do have a vaccination ahead of us, and I do want to tell our listeners, look, we've made it 9 months.
Mm-hmm.
We got maybe another 90 to 120 days. Maybe 160 days, but we're gonna make it. We're gonna be okay. You've been listening to Health Futures Taking Stock in You. I've had Dr. Borazanci here in the studio from HonorHealth Research Institute. Thank you for being here.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.